Doctors of Reddit, what's the weirdest thing you've seen at work? Mexican doctor here. Got a call from a patient who wanted me to check on his wife, since she had been laying in bed all morning. When I arrived I could smell rotten eggs and humidity in the room. Open the door and a body lays there, decomposed, probably 2 to 3 weeks, and the stench was strong. Because the mattress was all soggy due to the body liquids draining all over flesh. I took the poor old man outside and performed quick exploration. Finding his left eye is moving uncontrollably and non-respondent to light. We call his family and I give them the news. Turns out he had been an epileptic his whole life, but rarely took his treatment accordingly. Most probably he suffered a seizure that made him motor functional, but mentally challenged. One of the saddest cases I've encountered. That night I took a long shower, called my parents to tell them I love them. Had to take the dog in bed just for comfort. 3 months passed before I decided to do house visits again. Now I carry a hazmat mask in the car at any moment. Not a doctor, was a paramedic student and an oncoming crew came to get me so I could see the patient. If that happened you knew it was a good one. On top of that the crew themselves kept talking about how messed up it was, which could only mean it was pretty bad. Guy working at a dye factory got his hand caught in a mechanical dye press. It was exerting over 1,000 pounds of force for over 5 minutes on his hand. By the time they got it out it was partially amputated, and I cannot stress this enough. Flat as a piece of paper. The 3 middle fingers were just cartoonish looking in how flat they were. The guy could still semi-wiggle what was there, and could still definitely move his index and thumb. The surgeons were discussing WTF they were going to do when I was in there, and the general consensus I was getting was nobody knew WTF to do. I saw one of them prepping the guy's wife to see him, and they were just like IDK how to say this other than be prepared it's not good, and be aware this may have changed his life forever. To this day I cannot get over how unreal it looked. Like I legitimately thought it was fake, or I wasn't seeing it right. Not a doctor, but a paramedic. We were in a crazy busy metro system and we get called out for eye pain. 9 times out of 10, calls like these don't really require an emergency room. It'll be like an eyelash in an eye or something. I stride into the house and casually introduce myself and ask what the problem seems to be. The lady turns to me, showing her right eye bulging out about 3x further than it should, and says my eye popped out of my head. This is a new one on me. No trauma, no nothing. Just walking around and suddenly pop her eyes out of her skull. Holy crow. Lady, let's get you to the Turns out, she had a super dangerous clot called a cavernous sinus thrombosis. Basically, it clogged one of the drainage vessels for the brain and built up back pressure until her eye popped out. The doc said that most patients with her condition were in no state to have a conversation. So it was a marvel that she was up and walking and talking and complaining about her eye. Nurse here. Before I became a nurse I worked as a nurse aide on the ortho floor. Little old lady comes in with a broken tib/fib bone sticking out of her leg. Goes to OR and they fix her up. She gets discharged home. About 2-3 months later I'm doing a rotation on the burn/wound unit and I recognize her name on the board. I go in with the doc to assist him and he unwraps her dressing. You can see her skin on about 60% of her leg and grey muscle on the rest. He gently presses on a part of the skin and what looks like cottage cheese comes pouring out. Basically her adipose tissue had somewhat liquefied and was coming out in clumps. That same day another patient came in for his dressing change on his leg. They unwrapped it, and from mid-thigh down his legs was greyish green. Doc asked him if he's ready to have it amputated, and the guy points to his overpass bag in the chair and says already packed and ready to lose it. A completely missing inferior vena cava, totally occluded with clot, but had done so over a long period of time such that the body developed collateral vessels running up along the rib cage to empty into the superior vena cava. Essentially the big blood tube that brings blood back to the heart no longer existed and was replaced by a bunch of small tubes. Also saw a 4x4x4 centimeters out pouching at the upper small intestine which was filled with food resulting in obstructing the pancreatic ducts causing a pancreatitis. Lastly I once took care of a guy who came into the ER complaining of neck pain. Heroin user. Turns out he'd inject into his neck and immediately nod off, inadvertently snapping the needle off and causing it to bury and get stuck. Dude had like 20 vertical needles all over his neck. Medic here. Went to a rural hospital for a clinical day as opposed to my usual inner city trauma center I work in, which is a different brand of crazy, and we had to get an eyeball out of a woman's private parts. Apparently she was getting ready for a fight and needed to keep her prosthetic eye safe. So obviously the best way to do that is to pop it out and stick it up in nature's pocket. Well, it turns out that both the object and its container had enough lube to make it very difficult for her to remove. Anesthesiologist here. Part of me thinks I went into medicine because I'm inherently nosy. Anyway, in my last year of residency, we had this young patient and her husband. She thought she was pregnant as her periods had stopped and her belly was getting bigger. I don't know why she didn't go and see an OB, but point anyway, she was at home at a point where she thought she was 8 or 9 months pregnant. Felt something pop and a sharp pain and thought she was going into labor. Then, her legs went numb, and she could no longer walk. She and her husband didn't think that was normal, so they checked into our addition. She had a huge yolk sac tumor with mets to the spine, liver, and other places, and had to go for an emergent spinal decompression given her neurological symptoms. I wasn't the anesthesia resident for that case, but I was the one for her second surgery when they wanted to remove the primary tumor and resect some of the liver mets. Primary tumor was about the size of a basketball. I felt so bad for that young couple, but I still wonder to this day why they didn't get some sort of ultrasound or see an OB. Not a doc, but related to an ambulance doctor. They receive a call from a nearby village. They rush there, and they are told that the injured man is in the garage. When they go down there they find a completely disoriented guy with a fishing harpoon in his head. It entered through the lower jaw and the tip was going out the top of his head. He was disoriented and hitting against the pillars and the walls of the garage. They take him to the nearest hospital and the best Spanish cranial surgeon goes there from the capital in a heli. Several hours later, the surgery ends and the guy is conscious with little to no damage. I saw the x-ray and the harpoon went through the middle of the brain. The guy is still alive and perfectly well. I'm a medical assistant and scribe. We once had a patient who was convinced something was wrong with her scalp. She said her scalp was super itchy and dropping sand like rocks constantly. The doctor examined her scalp and it was perfect. No inflammation, no dandruff, a perfectly healthy scalp. He still sent her some topicals for itching and flaking and said that should clear it up. She came back a month later saying it has gotten even worse. Furthermore, she found a very rare disease on Google and told us that's what she has. He re-examined her scalp and it looked great still. He told her that and said, "I'm confident you don't have this, but we can test for it if you want." Patient excitedly asked for it and we did a biopsy along with a lot blood work. 2 weeks later patient comes back in. Blood work is normal and scalp biopsy is normal as well. We thought this would help the patient, but it did not. She asked for him to re-examine her scalp again. Everything looked normal. Finally he asked her if she has ever considered seeing a therapist, because we've ruled out any possible scalp issues and this could be symptomatic of a nervous tic. Of course he said it much more professionally than that. She starts getting very angry and demanding another doctor come take a look. There are multiple doctors in the practice and he says of course we'll have one step in just a few minutes. We treated this as a new patient for the other doctor. All I told him was itching scalp. Patient says there is sand falling from her hair. Patient thinks it's disease name, and this is her most recent blood work. When we go in the exam room there are white crystals all over her scalp, the exam chair, and surrounding floor. None of this was there 10 minutes ago. The doctor looks very confused and asks if there is salt on her scalp. She says no, it's from X disease, and adds that the first doctor is a quack. New doctor says, this isn't really what X disease looks like. These granules are way too fine and don't seem to be attached to the scalp in any way. Patient freaks out saying the whole practice is a scam and loudly leaves the building yelling at everyone. We're all pretty sure she poured salt all over her scalp when we left the room to grab another doctor. It was very weird. I hope she is doing better now, but she does not respond to our messages anymore, so it's likely I'll never find out.